Hi everybody, I'm Dr. Bill Sterett with Vail Orthopaedics and Neurosurgery here on a beautiful Colorado summer day. Here I'm going to talk to you today about shoulders that dislocate. You pop your shoulder out, whether it was mountain biking, skiing, playing lacrosse, just about anything. I've dislocated my shoulder, now what? People that are under 20, and especially under 18 with open growth plates, have greater than 90% chance of it dislocating again and again. We've talked about ligaments, and by dislocating your shoulder, you've torn the ligaments in your shoulder, and because they're inside the shoulder joint, they tend not to heal. So, if you're a 15-year-old that dislocated your shoulder playing lacrosse, going whitewater rafting, anything like that, the chances are it's going to come out again and again, and then more and more frequently. Let's talk about the other end of the spectrum, over age 35. Very unlikely, if it's your first time ever dislocating, no matter what sports you do, that it will ever pop out of joint again once it's dislocated. Why is that? Well, even though those ligaments are torn, the rest of our tissues are also stiff, aren't they? The stiffer the tissues are, the less likely you will be to dislocate, even though those ligaments are torn. So over age 35, and especially over age 40, there's far less than a 10% chance it will ever dislocate again. So if you're 40, and you've dislocated your shoulder mountain biking up on the Vail ski hill coming down the mountain, we might get an MRI and make sure you haven't torn your rotator cuff. But if you haven't, maybe go through rehab and not talk about surgery unless it's a second time dislocation. If you dislocate it a second time, probably you're going to do it over and over again. But if you're 20 and an athlete, and especially doing high risk sports, we call them consequence athletes because there's a high consequence of dislocating your shoulder. If you're hang gliding or a big mountain skier, you're class 5 rapids, it's time to get it fixed. One final thing to touch on, over age 35 in large, big studies, mostly out of Scandinavia, first time dislocators had a very high risk of tearing their rotator cuff at the time it dislocated for the same reason. Rotator cuff's a little stiffer, you dislocate the shoulder joint and it tears that rotator cuff. So, if you're 40, the reason I'd get an MRI is to look at the rotator cuff, make sure it's not torn before we head down that non-op path. I don't want to waste your time doing no surgery when it was clear that you needed it. If you're 15 or 18, same thing, I'd probably get an MRI, just make sure that it's actually torn ligaments, not just stretched out. Maybe you're loose jointed and it's just going to keep coming out, but we need to know that for surgical planning, rehab planning, what to do in therapy. Shoulders that dislocate. Younger guys going to keep dislocating. Older guys risk for tearing the rotator cuff at the time. Lots of risk factors to talk about. Get a hold of us on this information just below us. We love talking about this and answering questions, and we're pretty quick to respond as well. I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes. Thanks for listening.